All right, I think we're live. Hopefully, we're live. So I always like to give it a little bit of lead time here because sometimes YouTube is chaotic, but hopefully, let's see if chat can give me some thumbs up just to indicate that they can hear us, and uh, and I'll get you to introduce yourself. So just if you could tell people where who you are and sort of what you do.
So, yeah, thanks for having me. I'm Ryan Marino. I am a physician. I specialize in emergency medicine, medical toxicology, and addiction medicine, and practice in Cleveland, Ohio. But my one big area of focus has been kind of substance use and addiction issues, but particularly fentanyl, overdoses, fentanyl addiction, and then misinformation related to fentanyl that is very prevalent, especially in kind of the popular media.
Yeah, we've seen that here. I can just, I guess, share a little story that might be of interest with that. They used to, for court cases, bring in the drugs as an exhibit, and then fentanyl was the reason they stopped doing that. So now they bring in a picture. Um, so where I am, I mean, when we're talking about myths, uh, you've seen the sort of things about fentanyl killing people by being near it and that kind of thing. Um, what are your sort of uh, I guess can we sort of talk a little bit about the toxicity of fentanyl and sort of what the substance is?
Yeah, so fentanyl, I mean, very rightly so, has taken up a lot of news over recent years, especially the kind of quote unquote opioid overdose problem that has started out, I mean, in North America, but is really affecting many parts of the world now. Fentanyl itself is a synthetic opioid, so it acts the same way on the body that other things like morphine, heroin, oxycodone all do. But the difference with that is that for most of those drugs, they are all derived from compounds in the poppy plant, whereas fentanyl is completely synthetic, and so it doesn't require any sort of cultivation of poppies, doesn't require large tracts of land, weather, legal conditions for that, and everything. And so fentanyl has kind of taken prominence. I don't know if that's the right word, but has kind of taken over the drug market in recent years because of very successful efforts to destroy kind of the global heroin supply. And the U.S. government would be kind of the leading the charge on that, destroying the poppy fields in Afghanistan and then later in Mexico. And so fentanyl can be made pretty much by anyone. It doesn't take that much skill, training, or materials. You can order the precursor products over the internet and make it at home anywhere in the world with pretty minimal knowledge. And then because it is much more potent than things like heroin, you need much smaller amounts of it, which makes it easier to transport, easier to sell, easier to distribute. But then on the flip side, because it is so much more potent, it makes it much more potentially dangerous. And so, I mean, I think one of the misconceptions is that fentanyl is this kind of boogeyman drug that just kills people, but it's also a very important and useful medicine. And so, I mean, fentanyl was first discovered for medical use, has been around since the 60s, and is used pretty much every day, 24/7 in every medical facility around the world. It's one of the most important medicines that's used. It's used for pain, it's used for sedation, it's used for patients who are critically ill, on ventilators, that kind of thing. But because it's about 50 times more potent than heroin, or 100 times more potent than morphine, like a very small difference in percentage can be a big difference. And so the kind of rule of thumb is it's about the street drugs purity is about 50 times more than heroin, which was about 50% heroin, 50% cutters, cutting agents. And so if there's fentanyl on the street now, it's about 1%. The percentages differ, but this is just kind of to give an example. And so if you bought something on the street and the dealer, whoever had made an error, just because it isn't coming from a pharmacy. It's not on professional equipment. This is someone doing it in the black market. If it's off by 1%, that's a 100% increase in the dose. And so that's where all of these overdoses come from, and why it has kind of taken on this boogeyman mythos, I guess.
Yeah, and I mean, one thing, if you were sort of preparing this professionally, you'd probably be using things like a ball mill and other things to get a very precise, very fine radiation. I've sort of described it to people in the past as saying, like, if you've ever baked a cake and you end up with like a little cluster of flour, that didn't quite get mixed in properly. And your cake, that's not a problem. But if if you happen to be getting the dose of fentanyl that has that little lump in it, which might be, fairly small, you're at that point, you might be getting a dose that is way more than you expected, just because of, somebody's mixing this at home in their blender instead of with professional equipment and that kind of thing. So
yeah, and the dose does come in micrograms. I mean, in terms of like the solid version, that could look as small as like a little grain of sand, a speck of dirt, whatever. And I think that's also where this idea has come from, that small amounts can get into your skin, can get into the air, because we think of like trace things in the environment doing that, and that's just not the case for fentanyl.
now, I've actually had a lot of people request that I talk about this in particular, because there's a lot of people sort of in my chat and so forth who are people who use or have used fentanyl medically. And so that same potency for fentanyl, if I'm correct, that allows for a whole bunch of medical uses that you can't really do with say, morphine. Is that correct?
Yeah, I mean, it certainly makes it much easier and much more possible. And so, I mean, one of the most significant applications that goes to that point is the fact that there is a transdermal skin patch for fentanyl. And so, like, theoretically, at the end of the day, fentanyl can get through the skin. The fentanyl that's on the street is not the same as what's in the patch, and the patch is a whole new kind of drug. But because the skin is such a good barrier, they have to put orders of magnitude more drug into that product so that small amounts can absorb through the skin. And so if you try doing that with morphine or something, I mean, you'd end up having like a big fishbowl stuck to your back instead of a discrete patch there. And so, I mean, that has kind of revolutionized pain for people, having that kind of continuous delivery system being more convenient.
Yeah, when I burned my hand, it was, you take pills, but the up and down of sort of the pill aspect was not pleasant. And I understand that the patches can sort of help a lot of people with chronic sort of pain there. But
Yeah.
I see somebody in the chat is asking, fentanyl testing kits, do they indicate the presence of it, or do any of the tests have indicators of how strong it is?
So the fentanyl testing kits, which for anyone who uses drugs from the street, even if you're not using heroin, fentanyl, or anything you think is an opioid, it's now showing up in kind of everything. They're great to be familiar with, and they're very easy to use, but they are just a qualitative marker. They do not tell you if it's fentanyl itself, if it's another fentanyl analog, fentanyl derivative, and they're not 100% accurate. So sometimes they don't detect the fentanyl that was there. Sometimes it is another related structure that won't be picked up by the strip. But definitely, better safe than sorry. More information is always better. And yeah, they are very easy to use.
Yeah, doing criminal defense, I'm starting to see it in all sorts of things, including sometimes people who are picked up with something and they're surprised when the police test it and find that, their meth had a substantial amount of fentanyl in it and so forth. Because as you were saying with the like the opium fields getting burned, it's becoming really easy for people to smuggle this in. They can smuggle a tremendous amount in a small area, and so it's becoming cheaper for dealers to use that and throw it into other things to if your meth's not all that great, you can throw a little bit of fentanyl in there. It's so that's another sort of area where I see overdoses, is people who didn't think that was the drug they were taking. But
yeah, and
and
we're even seeing, because it's so much more potent, the little traces that are left on like the scale or table or whatever, where these drugs are being kind of divided up, weighed, measured, distributed. Because again, this isn't regulated pharmaceutical stuff. This is happening like on someone's kitchen table. And so the black market is not ideal for ultra potent drugs like fentanyl.
And a lot of this seems to me just to be an artifact of the fact that we ban things so heavily, because I'm sitting here drinking a Coca-Cola, which contains a psychoactive drug, right? The caffeine, but I know it's going to have pretty much exactly the amount of caffeine it promises to have on the can. But if I was getting this made by somebody in their bathtub, then, who knows what it would have. But we've given the market over entirely to people who make this stuff, without all of these precautions.
Yeah,
so
exactly.
Is that sort of your thoughts, or what do you like? How do the laws play into all of this?
Well, so I think someone in the chat had brought up this notion or theory, I don't know what you would call it, but the iron law of prohibition, which is kind of, as you criminalize or ban these substances, people will move to more kind of clandestine methods, more potent drugs, more synthetic, more hidden ways to do this. And so, fentanyl is a great example. Before, heroin was illegal in most places, or many places at least, and heroin was still like what people wanted, what was being grown. And with the successful kind of destruction and increased criminalization on the opium and heroin supply, we moved towards fentanyl. And we've even seen recently, with kind of pushing towards criminalizing fentanyl more and more, that people are being punished who use this medically as well, but the people who are using drugs on the street are now being subjected to weirder and weirder things. Xylazine, which is another veterinary medicine, is showing up in a lot of the drug supply in the United States. And even more potent opioids, the nitazines, have been detected in a number of places. And so it seems like the more we kind of criminalize this, the more we're pushing people to less safe and more dangerous things.
I've actually had clients say that they're upset that they can't find heroin anymore, because at least the heroin was relatively, safe as they used it. And when you're talking about this sort of mixing aspect, I'm just thinking back to somebody who, when the police were interviewing them, they noted that they mixed it with their hands, like these drugs, which I think connects to one of the other things that we're seeing, which is a lot of panic about fentanyl, um, sort of contact toxicity or aerial toxicity or all of these sorts of things. Do you have any thoughts on that?
Yeah, so that is kind of the popular narrative in a lot of like media reporting, and it seems to primarily be related to kind of law enforcement as well, which is interesting that it goes kind of hand in hand with this increased criminalization narrative. But certainly, people have been using fentanyl for decades. People are making and selling fentanyl, and are not having any adverse effects just from proximity to it. But we have good scientific evidence too that it doesn't easily cross your skin. You can stick your hands into a bucket of fentanyl. There's a lawyer in the United States who did this example and has a video posted online. And then, yeah, in terms of the aerosolization, the molecule itself just does not aerosolize under normal conditions. People can snort the powder, but it's not something that just gets into the air on its own or ends up in your body unless you are intentionally ingesting some sort of substance. Whether or not you're intentionally ingesting fentanyl is kind of the problem, and overdoses and dying. But certainly no one who goes to an overdose scene helps someone who uses drugs or is around someone who uses drugs is not putting themselves at any increased risk for fentanyl.
And I've heard of this having sort of detrimental effects on people who are legitimate, like prescribed fentanyl users, because, and also people who have suffered from overdoses, because I've heard of situations of, emergency care workers being afraid to approach people. Is there sort of any change to the training around that?
Well, so yes and no. I mean, that's definitely a thing. I've seen that happen firsthand where people will not want to go respond to someone who's experiencing an overdose, where we know that, I mean, time is incredibly valuable when you're not breathing, you're not getting oxygen to your brain and your other organs, because of this risk for some sort of secondhand exposure to just bystanders. And that isn't the case. That's not a real thing. I don't know why it's so hard to kind of dispel this myth, because there is a lot of strong science that says it's not something to worry about, but it keeps getting put forth. I think in terms of kind of like first responder, emergency medical services training, there has definitely been a push to try to correct that, but it's still an area that needs a lot of work.
And one thing I see, it's always kind of funny because I never hear about doctors or nurses having full on overdoses when they're administering these things. But we hear about police supposedly having these overdoses all the time. And what's going on with that?
Well, so, I mean, I work with people who use fentanyl every day. I give fentanyl almost every day in the emergency department with people with bad injuries and other illnesses, and have never had any issue. I mean, I've pulled packets of fentanyl out of patients' pockets, and not had any issues with that. Certainly you want to use kind of basic precautions, gloves and masks. We're still in a pandemic here, but nothing out of the ordinary. And so in terms of kind of looking at these stories and what's going on, I can only speculate because I haven't, I'm not the person who's experiencing these symptoms, but it does seem to be genuine symptoms. The thing is, they're just never the symptoms that are consistent with a fentanyl exposure or overdose or any sort of opioid. And so the reports will usually be that someone became extremely fearful, anxious, started breathing very rapidly, thought they were going to die. Their body was shutting down, which it's also usually very non-specific type symptoms. But these are actually the opposite of what fentanyl or other opioids would do. And so, I mean, one of the main uses that we have for fentanyl is for kind of like end of life care for people who are struggling to breathe, someone who's on a mechanical ventilator, giving them fentanyl so that they don't realize that a machine is blowing up their lungs to help them breathe, or that their lungs are full of pus or something. And also, I mean, fentanyl is relatively easy to detect and test for. And so the gold standard of testing, which isn't available everywhere, but is very accessible for people to send out if they're worried about it, which is gas chromatography, mass spectroscopy. But it can detect the most minute amounts of fentanyl in the human body. And in none of these cases have they ever shown that happened, unless it was someone who was actually just using drugs.
I always think it's weird that, my client has been walking around with like a packet of fentanyl all day and consuming fentanyl like from that intentionally without issues, but the police officer just handling like a sealed baggie is suddenly, it's like, how does this make any sense? It's
yeah, and it'll be like they pulled a car over and there were 4 people in the car and they were locked in the car with all the fentanyl, but the second the window opened, the officer went down. And it doesn't make any sense.
The other one that I've seen that I thought was a little interesting was officer opens up a bag which has a powder in it, and then immediately noted that they were experiencing symptoms of an overdose. They put that in their report, and they actually got a Narcan injection or a Naloxone injection, and then later when that was tested, it was actually just buff. So the stuff that they use to cut drugs, there was no drugs in that bag. I mean, I'm always my theory, and I'm just wondering if you can, is that these always seem like panic attacks to me. When people are talking about their agitation, their increased heart rate, which increased heart rate isn't what I'd expect, right? So
yeah, and it fits with, if you're hearing every day on the news that fentanyl is killing thousands of people, and it's killed hundreds of thousands of people, small amounts, it's getting in people who aren't intending to use fentanyl. I mean, kind of all of those pieces are there. We don't have great education on drugs as a society in general. And so, I mean, I think telling people all of these scary things, it's natural to have that kind of fear. And especially if you see all these other stories where someone was just nearby it or touched it or something and then went down, that would lead you to think that it could happen to you. And so if you know the placebo effect, where like you believe so strongly that something is going to help you, that it gives you some sort of benefit, even though it could just be a sugar pill. There's a flip side to that, the nocebo effect, where if you believe so strongly that something can hurt you, you can actually have bad negative symptoms. And so I do believe that in the majority of these cases, people are really experiencing a true medical situation. It's just not related to the fentanyl. It's related to kind of the misinformation and the fear mongering.
I've actually struggled to find even what I'd consider a single credible case. And in a couple of them, I've led me to be suspicious in other ways. There was one well-reported account where a police officer was saving his friends at a party from an overdose and was coming in with, and he says, "Oh, that was just from contact with all my buddies who were overdosing." And I was thinking, really? Really? Everyone else at that party was consuming drugs except you? You just happened to be the guy being the hero? Because of course he's the guy who'd get fired if that was so.
Yeah, and law enforcement officers use drugs at the same rate as everyone else. So I mean, you can assume kind of like maybe a quarter of them are using some sort of illicit substances. A good percentage of that is going to be related to fentanyl, especially at this point. And so, I mean, if someone has some sort of negative event from using drugs on their own, or has a drug test coming up, it's also very convenient to say, I was exposed to fentanyl through work.
I'm sort of reminded, because it seems like every generation has its own drug sort of fear. We've heard about angel dust making people superhumans, and all of these, and go back far enough and it was reefer madness. Is this just kind of the latest round of that?
I think so. And I mean, I think there were some questions here in the chat too, and you kind of alluded to what this is being used for. And so not only kind of speculating that maybe people are using drugs and using this as a good excuse and people having a lot of panic attacks, but it definitely has been kind of weaponized against the people who use drugs to charge them with increased crimes, or to get increased funding for your department, or to maybe take some sick leave because you can say you were exposed to fentanyl and had a medical emergency without having to say that it was a panic attack. So there's definitely, I think, a lot more going on than really meets the eye, and it's not good.
All of these, that's, I guess, a sort of point I wanted to get to, is that all of these things, it's easy to say what's the harm, but there are real harms here, and that seems to include a lot of people in the chat are talking about how if they talk about needing opiates, if they are in pain, that there's been such a response of pushing back against that. So how do opiates sort of figure into pain, like pain management for people?
So they remain probably the most effective pain medication for anything more than kind of like minor aches and pains. There's certainly a lot of kind of nuance and considerations. Being on long-term opioids is not ideal, and it is going to lead to kind of them not being effective as well. And certainly we had issues where they were overutilized, overprescribed very early on for, I mean, like a twisted ankle or something, someone would get a month's supply of Oxycontin. That too is extreme. But we are now at the point where people can't access pain medications, even in the situations that really should be getting them. People who have been on these medications for a long time and are dependent on them are being cut off without any other good options. And I mean, people will tell me when I'm trying to treat them, say they have like a broken bone sticking out of their leg in the emergency room, and we say that we're going to give them some fentanyl. It's very common now for people to say, "Oh, I don't want fentanyl. That's what kills people." And we kind of saw that like after Michael Jackson died from propofol, which is no one's getting propofol in their bedroom when we give it medically. But the fentanyl thing seems to have kind of taken it much further. And I mean, it applies to other stuff, but like even the drugs that people were using on the street, the OxyContin, Percocet, whatever that was being sold, that no longer exists. Now everything is just pressed fentanyl. And that's kind of scary. So I think we're setting people up for a lot more additional risks by kind of overcorrecting. The pendulum has swung too far, would be my personal opinion.
I'm actually seeing some interesting, like Tylenol 3s that are just like fake Tylenol 3s that are actually pressed with fentanyl are, sort of all over, and fake oxys and so forth. They're just all over on the street these days because easier to easier to get fakes than the real thing.
Yeah, and even I've seen people who thought they were getting Xanax, people who thought they were getting Adderall, and it ended up being fentanyl, and there was just no Adderall, nothing even similar to that in the pill, and same with like the Xanax and other things. So it is kind of weird, and thinking about this drug war and how we just try to restrict and criminalize things. We're not giving people any good options when we go to that extreme. It's the reactionary measures.
And I see a super chat here I'm going to bring up because I think it makes a really good point. That's what he's saying. Lost my best friend to laced fentanyl last year. He looked to the street for pain relief since pharma narco became too hard to get due to regulations. I've actually seen that as a pathway to street drugs, particularly in like tradespeople. And everybody's got this idea that like the heroin addict or the opiate addict is sort of the skinny, scary looking person at the street corner. But a lot of the people I'm seeing are like tradespeople. And I suspect that there's a lot of lawyers and a lot of, everyone else who are, but the pathway I've seen is people who get injured on the job, get prescriptions for lasting pain, and then get cut off after like 2 weeks and told just suffer it out. And then, look to the streets, because if somebody's in pain, what else do they do? So, is that something you see? Like, is that something where, I guess, can you sort of talk a little bit about the profile of who these people are?
It's really everybody, like you said. I mean, there's no certain person who is more likely to use these drugs, or more likely to have a consequence from them or not. So I mean, I see patients who are as young as 11 and buying fentanyl on the street, and are in their 70s and 80s and buying fentanyl on the street, and people are using it for all different reasons. It's most of the time for pain, especially when they know they're getting fentanyl, or turning to like heroin and fentanyl. That's more often than not is people are trying to self-treat pain, even more so than like the recreational kind of quote unquote like high, it's more likely for pain. But I think too, people being cut off of these prescriptions does drive them to kind of extreme measures, because the withdrawal from opioids is, say you were on it for whatever medical condition for, I don't know, a few weeks, a few months, a few years. Most people are going to experience some withdrawal, whether they were addicted to it or not, and most people are not addicted to it. But the withdrawal is quite miserable. People will tell me it's like the worst flu of your life. Every part of your body feels miserable. They'll turn to anything. And that is like the riskiest situation, because those people have a lower tolerance, even just in the few hours that they've stopped using. And when you turn from something like the OxyContin that you were getting from the pharmacy to whatever's on the street, like fentanyl analogs, veterinary drugs, who knows, then there's a big risk.
Yeah, and it's actually been really terrible to see. Just I think you'd have a hard time finding a criminal defense lawyer who doesn't know clients that have died from this. It's and as we were saying, it's not always sort of who you'd expect. People who are like, oh yeah, I'm a heavy equipment operator, or I'm a pipe fitter, and then just 2 weeks later you get a call and this person has has had an overdose and died. So it's a really sort of major thing. I actually had sort of a video sort of encouraging people to potentially pick these up, because where I am, you can get like a naloxone kit just at the pharmacy, and you never sort of know when you're going to encounter somebody. It's a lot of job sites, for instance, will have a first aid kit, but nothing like this in it. And a lot of the first aid kits, this has real potential to save somebody. And it's not, at least I've never used it, but from what the pharmacy was going over, it doesn't seem to be too hard to use. Are you seeing more push to include these things? Like, we've got defibrillators in malls and so forth, but I don't think I've ever seen a naloxone station like at the mall.
Yeah, I think that's a great analogy too. It is, I mean, it's like a defibrillator. It's a lot easier to use than a defibrillator. But in terms of opioid overdoses, are one of the leading causes of death, and it doesn't seem like they're showing any signs of slowing down. They can happen to anyone, anywhere, anytime. And those Narcan kits, the nasal spray, is incredibly easy to use. It was designed so that a child could use it without any training, which sounds sad, but I mean, it's the kind of best possible case scenario. And so, I mean, I think keeping it in places in public like that, like a defibrillator, I mean, you wouldn't want someone who could survive their heart attack to just drop dead in public because there was no defibrillator around, the same way you wouldn't want someone who otherwise had no reason to drop dead to die from their overdose.
Yeah, which is it's every time. The other thing is there's a lot of stigma towards people with addictions, but everybody needs to remember that these are people with families, with siblings, coworkers. Their absence leaves a hole in people's lives, and this is part of the tragedies that people experience. We've seen some people in the chat talking about how they've lost like friends and loved ones. And I mention this because every time I talk about naloxone, there's always somebody out there going, "Oh, just let them die." And I mean, the lack of sympathy is something that I think is also a problem there. Nobody sort of judges you if you have a heart attack at the mall, but if you have an overdose, then people are going to be, there's a very different sort of social reaction to that. So
Yeah, that stigma, I mean, is definitely still very prevalent, and it's probably the biggest issue in terms of kind of dealing with all of this. And just in the US, losing over 100,000 people a year to overdoses, every single one of those is an entirely preventable death. And I mean, the vast majority are related to fentanyl. So if we could stop 70,000 people a year from dying, I mean, not only does that not have people's lives torn apart from losing their loved ones. I mean, I can't even count how many people I've lost, but definitely some very close people to me, and I wouldn't wish that on anybody, because once it happens, like, it's too late. You can't bring them back at that point. And so
No.
something as simple as Narcan can make a huge difference. I wouldn't wish that on anybody.
And somebody was asking, how hard is it to administer the nasal version, and what if they aren't breathing?
So it is very easy. It's usually just, I mean, it looks like any sort of nasal spray medicine, but it's one dose. And so you just put the plunger in the nose and press it down. If someone has been in an overdose for a long time, really isn't breathing, anything like that, there might be some delay. It might not be as effective, at least right away. But certainly it is always the right thing to do. I mean, if you found someone down and are worried about an overdose, there's no downside to giving it. The worst thing that Narcan can do to someone is give them withdrawal symptoms. So, I mean, if someone ends up throwing up for 30 minutes, that certainly is unpleasant, but it's better than risking life or death. And I mean, I have Narcan in all of my like work bags and stuff in my car. It's really easy to get. It doesn't really require any training at all, but it has very simplified instructions on the box.
Yeah, the kits they give us here are actually little injector sets. So there's which I guess is a little more challenging to use, and I think some people might be a little more reluctant to use it, although it's just an intramuscular injection, so it's really hard to get wrong. And somebody's saying, how do you tell when someone needs or naloxone unless you know them? They actually, when you go and get this, they go through the symptoms of an overdose. But the other thing is that from what I understand, naloxone and Narcan are fairly safe. You were just saying the worst thing that's going to happen is you're going to get an overdose aspect. So
yeah. So someone who's having an overdose from fentanyl the main things to look for is they will be unresponsive and have significantly reduced breathing, whether they're completely not breathing or just breathing very slowly and shallowly. But if you were to encounter someone like that and gave them Narcan, I mean, if they didn't need the Narcan, they would be able to push your hand away, and there is really no downside to giving it. It isn't always going to work 100% of the time, but it's better than 0% of the time.
Yeah, and the other thing I'll just sort of tell people, because there's always some people in the chat who are like, well, I don't care. Even if you don't actually think you care, it affects people. You know, if you were just there and you see somebody, even somebody you don't know, you don't have any connection to, you know, you'll probably be thinking years later, could I have saved this person? And,
yeah.
you know.
And even if that doesn't matter to you, like at the end of the day, every time someone dies from an overdose, that has a huge societal impact. I mean, it impacts the community, it impacts the economy. I mean, just transporting someone who is having an overdose to the hospital instead of reversing them with Narcan wherever they are is already adding thousands of dollars of medical expenses. And then every time like a young, otherwise healthy person dies, I mean, that takes someone out of the workforce. Their family is then saddled with all of the problems that go along with that. So it's not just kind of like the opinion on the person who uses drugs. This is something that impacts us all.
Yeah, that's I think that this is sort of an important topic, and I will sort of keep talking about it because this is sort of a crisis, but it's really important, I think, that we sort of break up some of the stigma, because there's so many people I see getting either over criminalized, which the criminal justice system doesn't really help any of the the addiction situations there, but it's really sort of difficult when I see people talk about their pain management in the chat, going that they can't they can't get the meds they need. I have I've been on the other side where I'm one of those people who doesn't want to take the opiates that get prescribed there because I'm always sort of nervous about that. But I have attention deficit, and I've been moved off medications because of the war on drugs. They're like, we don't want to give you that anymore. That's too abusable. We're going to give you this other thing. And what's his? And I see also the note about Narcan is temporary. Somebody who needs Narcan needs an ambulance. That is one of the things that they do suggest, or at least they did when I got the kit, which is call the ambulance and and go for the kit there. Somebody's asking, what does fentanyl do physiologically? How does it work?
So fentanyl is just another opioid. It works the same way that other opioids like OxyContin, oxycodone, heroin, morphine all work. So primarily the effects at the lower doses are going to be like pain, treatment of pain, but the effects that it has on receptors in your brain also will eventually suppress breathing, and certainly has effects on like reward pathways and stuff, so people can get addicted to it. But the biggest issue is, I mean, when you get a drug on the street, like I said earlier, we use fentanyl all the time in medicine. It's probably one of the most ubiquitous and commonly used things. But when you get it on the street, you have no idea what dose you're getting, what else is mixed into it, whether it's, I mean, even if you know it's fentanyl, there's other different analogs of fentanyl. I'm sure people have heard of, like carfentanil is more potent. And so just a lot of risks with this completely unregulated supply.
And I see somebody noting that they were on the transdermal patch. Medical personnel made me feel like a junkie, even though there was no high. So glad a doctor fifth opinion finally correctly diagnosed me, and I was able to get off it. So
this kind of the talk of like the medical opioids and even like ADHD medicine and people who take benzodiazepines, the stigma that they're facing is really the flip side of the same coin that people with addiction are facing. And so I don't think anyone's pain should be untreated. I don't think ADHD should be untreated. But the sooner we kind of work through the stigma with people who are using these drugs on the street, we can kind of fix the way we perceive people who need drugs medically as well.
And from what I understand, it's fairly hard to use it or to get any sort of high off a transdermal patch, so long as you're using it appropriately. Like people just, they don't. It's not something that gets people high. It just gets people some pain relief. Is that sort of?
Yeah, I mean, people can find a way to misuse anything. I mean, go to a pharmacy, you can get stuff over the counter that people can use recreationally, but the patch itself takes more than 12 hours to deliver a therapeutic effect. It's designed to kind of deliver a constant dose so people know what they're getting, but it's a therapeutic kind of lower dose. And so it should just be used to kind of relieve pain and keep people functional.
Yeah, nobody who wants to get high is waiting 12 hours for that. So, and I see also people noting that ibuprofen is bad on the organs, which I think is worth noting because all of these things have substitutes, and some of the stuff that they put in as anti-addiction remedies in these things actually are just things designed to hurt you if you are trying to abuse it.
Yeah.
Do you see people like coming in with organ damage and so forth from Tylenol 3s and so forth?
Very, very frequently. Tylenol is one of the most common things that I see people very sick from with the liver injury. The non-steroidals like ibuprofen, naproxen, Aleve, those kind of things also, I mean, can cause their own problems as well. Not usually quite as bad. But I mean, I think one other thing that's often overlooked in this kind of discussion is like something that people will turn to when they don't have access to other whatever recreational kind of non-medical substances and medical, I mean, treatment of pain, whatever, is alcohol. And we have tried prohibiting alcohol and saw the exact same thing where it became poisonous. But now we have kind of embraced alcohol, and so we don't see people getting poisoned from it in the same way, but are also kind of encouraging people to use substances that all have problems. I mean, anything can be unsafe, but so the demonization of certain drugs and substances over other ones just never makes sense to me.
Yeah, and I see somebody saying that they lost their wife to this given by EMS and ambulance. I don't know if that's referring to fentanyl or to naloxone or Narcan. I've never actually heard of a sort of naloxone or Narcan injury. I don't know if that's. I've heard of occasionally people being quite upset when they're woken up out of things because it's actually kind of interesting about the effectiveness, which is that sometimes you've got people who are waking up upset that they've lost their high. But and I see people noting, or one person saying it worked well for pain, but med staff will shame you. Yeah, I've heard a lot of people about that. And I also see people talking about marijuana products. Do you have any thoughts on sort of that as a pain treatment? I don't know if it's legal where you are.
Yeah, it's kind of up in the air all across the U.S., but moving towards legalization. And I think the kind of pain aspect still has not been conclusively shown in the evidence, but people will say that if marijuana products or just cannabis, the flower itself works well for their pain. And in terms of kind of having access to options for pain, it seems like we should want people to have access. Whether I can say that this is a pain medicine for everybody seems irrelevant if someone could just go out and see if it worked for them. And that's another example too, where we were seeing, because it has been so criminalized and demonized, I guess, to kind of keep repeating that word, the synthetic cannabinoids people were developing to escape these laws and get around the legality got so far from what just the cannabis flower does. I mean, I remember the synthetic cannabinoids from several years back when that was like a big thing. People were running down the highway naked, having serious organ injuries, just because of this kind of like iron law of prohibition. And when you can go to a dispensary and get a product that you know is going to be like regulated down to a certain percent, you know, the dose, you know that there's not going to be anything weird in it, that makes a lot of sense. It's going to keep people a lot safer.
In Canada, we've legalized marijuana, although there's restrictions on how much you can have on you at a given time and all of these things. But what we've actually seen is that a lot of the drug dealers are getting pushed out of that market, especially with fentanyl being on the street, because like, okay, do I want to go to the guy on the street corner? And some people still do because they think they can get a better product. But if you go and you can buy like an oil that'll have a regulated amount, or like an edible that'll have a specific amount of THC, and I think that's a real improvement when you're talking about what you're getting, that it's not been it hasn't been sprayed with pesticides and so forth. So, and I see people saying, and you still can't carry it across the street or across the border. Yeah, you will get in a lot of trouble. Canada actually bans you from leaving the country with it, even if you're going to a country that allows marijuana use. So don't do that. But yeah, and I see people asking about Kratom, and that's one of those synthetic cannabinoids, correct?
So Kratom is actually another opioid from a Southeast Asian plant, and so it is like a historical part of different cultures there. But at least in the U.S., it is considered a supplement, so it's completely unregulated, and it's sold kind of at like head shops and gas stations. And so there was an outbreak of salmonella related to Kratom products a few years ago. There have been people who are making and selling this will spray on like additional drug to it, so people will have problems related to that. But overall, I mean, it remains very understudied and probably like a pretty useful and potentially beneficial product, that unfortunately, because it has kind of been pushed into this like negative space, is unlikely to be appropriately studied or kind of broadened out in terms of who it could help.
So it's one of these examples of things that have psychoactive properties but are or aren't regulated, which is always interesting to see because, again, I consume a large amount of caffeine, but nobody, and it's largely safe because because of the fact that it's a legal product here. So I see some super chats here that we should get to. Gene Clark was saying thank you. So, and Stefan Kochan saying opioids don't work for me. Get high but no pain relief. Ibuprofen is the only thing that works for pain quite well too. And I think it's worth noting people have different reactions to different drugs. The thing that works for one person doesn't work for another. So this is why there are pain relief specialists and not just like a manual of how much to give you for your body weight, because you got to work with all of this.
And also why it's good to have more options. When we restrict these things too much, people really will end up suffering.
And I see K-Rab is saying most doctors I've had told me opioids are ineffective for chronic pain, but the best doctor I had said to be effective, it had to be taken on schedule to stay ahead of this pain. I never had any addiction issue with addiction, stopped at will. I've seen like a lot of people with chronic pain who are on opioids, so I don't know if does this meet with your sort of thoughts on that?
Well, so their effectiveness is less when they're used for a longer amount of time, and people can be a kind of risk for like significant tolerance, and even kind of increased pain from the way they downregulate your receptors. But they do work for some people, and there are definitely some indications where people really have no other options. And so, I mean, not allowing them to have any sort of pain control or cutting them off after they've been on is not great. But the point about addiction being kind of a low risk is, I mean, even for someone who goes out and buys heroin or just now, I guess, all heroin on the street is fentanyl, and goes home and injects that, their risk of developing opioid addiction, I mean, even from something that, like you pointed out, has been kind of, there's such a stereotype of who would even be doing that and like what point in their life they would be. The risk of ending up with addiction from that is incredibly low. And so, I mean, even people who take like chronic opioid pain medicines or use heroin or fentanyl every day, most of them will not end up addicted.
And what's the role of sort of traumas to addiction?
There's a lot of overlap. And so, I mean, in terms of kind of self-medication, not just with fentanyl, not just with opioids, but people are using this to try to medicate trauma. People who have had significant traumas and turn to substances have higher risk for addiction and other complications related to it. But that's another reason too, we're doing a disservice to everyone by not kind of treating the things that cause the trauma, by saying that like don't resuscitate them, just let someone die if they're choosing to use these drugs. They know there's a risk. We could do a lot more, and certainly, I mean, socioeconomic factors, all of that other stuff play a big role.
It's I know that there have been treatment programs here that have basically sort of, a lot of them have come to the conclusion that if they're just trying to treat the drug aspect without providing things like mental health and therapy elements of it, that it's usually it's not nearly as effective. So people are surprised when I say, oh, they're going off to rehab and this week they're they're doing counseling, right? Because it's, I think it's or at least it seems to be a huge factor, at least with the one with, and I only seen a portion of the addicted population. You're going to see a different portion, right? I see people who are getting charged. All right, hopefully I've got my audio back there. But I only see people who are getting, caught involved in, criminal activities or who are busted for possession, but or distribution sometimes. But you might see people who are coming in because they've had a medical, aspect to things as well. So you might see a broader group than I do.
Yeah, I mean, it's really everybody at this point. I mean, I think in terms of our like quote unquote opioid epidemic that's been going on over the past decade or so, looking back at kind of the changes in society and culture since like the 90s to be, or maybe even the 80s to be honest, like kind of increase in despair, increase in kind of like broad trauma, hopelessness. There's a lot of negative things going on in the world that definitely seem to be related, whether that can ever be like definitively proven or not.
Well, I've heard sort of anecdotally that this is a big factor for rural use, because there's a lot of people sort of living rurally who are watching various jobs sort of dry up and are struggling over that, and we see people turning to drug use to compensate for that. Um, do you do sort of any rural sort of work, or is it just within? You said Chicago is your stomping ground, correct?
In Cleveland, so I'm mostly in an urban area, but there's definitely pretty rural areas not too far away from here, and I've worked in other areas in like Pennsylvania, and so that definitely is a big issue. The way kind of things have gone, you can kind of just look at over time the rates of opioid use, the rates of psychological as well as physical pain, and reasons people have for attempting to self-medicate for any of those reasons.
And I see somebody noting, it's me, Bob was noting, there's a stigma with just having the Narcan kits. I was kicked out of my dorms because the school thought I was bringing bad people back. I think that's terrible. If I was running the dorms, I would be telling people, listen, here's the Narcan kit. There's going to be one on every floor and maybe two, like one at each end of the hall, so you don't run the wrong way. Because that's not how I'd run a dorm at all. So, but there is that stigma,
Yeah.
people. When I did my video on talking about the Naloxone kits, I had people, saying, "Oh, I'm unsubscribing because Runkle supports addiction." I'm going, I support people not dying.
Yeah. The alternative to that, I mean, is having people in the dorm die, and so I mean, it's a terrible position for them to take, and I mean, it's objectively bad. But I think the more we can normalize kind of like having Narcan everywhere, everyone carrying it, then the less of that stigma that can still exist. I know here we have private insurance companies have tried to kind of kick people off or reduce their benefits, because they had a prescription for Narcan.
Jeez, that's just that's terrifying. And I see it's me. Bob is saying that this was in Edmonton. Feel free to shoot me a message on Twitter, and we'll sort of talk about that, because I think that's something that we should try to work on fixing if we can. If the dorms are being are behaving in that fashion. I see we've got a question. What do you do with patients that have to have opioids for pain relief? My family gets no pain relief from other meds. We're constantly worried about being labeled drug seekers, which means no relief from anyone.
Yeah, so this is, I mean, it's a big problem. I am not a pain specialist, so can't really like speak to all of those aspects, but it's definitely something that I see happening a lot. I mean, pain needs to be treated. It's kind of a very fine line and a lot of nuance, because not everyone needs an opioid. Some people can't have other things. Some people can only have opioids. And so you want to kind of find that line there. And a lot of times, especially recently, the default has just been to say no opioids, no anything, label someone a drug seeker for whatever reason that isn't good. That's not good patient care. That's not a good way to kind of maintain like a healthcare relationship with anybody. And even people who have addictions to opioids can still have pain and need stronger drugs, need their pain treated with something stronger.
I've heard some terrible stories of people who've had that, drug seeking behavior labeled on their medical file, and then end up coming in with a real injury, and they're like, "Oh, well, you broke your arm to get opioids, so we're not going to give you any," that kind of thing. So, I have some opinions on the sort of the drug seeking behavior label that gets put on people, because it can have real impacts there.
Yeah.
I see somebody was noting here that just scrolled. My workplace is looking to have Narcan available in our offices. We do human services work. I think it's a good idea. I think that, law firms should have it, courthouses. I'm pretty sure the Edmonton courthouse does have it, but and just all sorts of places, job sites, hotels. If a hotel doesn't have somebody with a Narcan kit that they can run up to a room at they're probably not doing their doing things right. It just makes sense. And Jason Lizotte was noting, as a pre-hospital provider, I administer fentanyl to patients every day. With all the new coverage about illegal product, it's confusing to some patients. I have to explain that ours is regulated and made in a drug company. So that'd be an example of the hysteria harming patients, because they're now afraid of the medication that's being prescribed to them.
Yeah, and it's incredibly valuable. I mean, fentanyl is, he said, administered to patients every day. Without it, people are going to have very severe untreated pain. I mean, it's probably like one of the easiest to dose and lowest side effect profile of the opioids. So it's not going anywhere anytime soon.
I see most doctors I've had told me opioids. Oh, wait, we looked at that one. Angry Canuck is saying, is there any solid proof that China is bringing in fentanyl? I remember U.S. government brought in cocaine, and Big Pharma paid off doctors during Oxy pandemic. I think he's talking about the Sacklers there, who there's been a whole big legal proceeding around that. And that I don't think was terribly helpful with the, I guess for the people in the chat who aren't sort of familiar, there was a big push to sort of, for a while they were saying opiates should be prescribed regularly and they have no side effects or addiction profile. And that was not a good approach either. I guess it really illustrates the danger of myths both ways, right? If we say something is perfectly safe when it's not perfectly safe, that's itself a danger. But if we say it's this super dangerous product, that also hurts people.
Yeah.
And I see with them saying it's more of fentanyl poison versus overdose. Do you think they will start prosecuting dealers for murder? Tricky part is it on the dealer, the people manufacturing it in China or Mexico. In the States, I've heard that they've tried to push that. In Canada, there have been some manslaughter convictions on that. Murder is hard in Canada because you have to show a specific intent to kill somebody. So it's going to be very hard to show that the dealer meant to kill their patient. And I don't know that that's necessarily a good approach either. And I see somebody saying in the UK, our first aid kits are bandages, wipes, and tape. I will go on a minor rant. Most first aid kits suck. If you go to your local pharmacy and you buy a first aid kit, it's not going to be great because it will handle boo-boos, but it won't handle anything important. Add this to it and you increase your ability to save somebody. But take a stop the bleed course is the other thing I'd suggest to people. Because The stuff that you need a first aid kit is not like a finger bandage. It's something like this guy just got his arm torn off by this machine. And so if you don't have a tourniquet and an ability to and know how to use it, those are things that you should get. And I see people noting that real first aid kits are expensive. They are. And people recommending the stop the bleed. Yes, stop the bleed kits are fantastic for that. And Allison Barnes, thank you for the super chat here, noting this is such an important topic. Thank you for covering. I'm not a user, but I volunteered at a women's prison in Tennessee, and it scares me for all those girls who unfortunately use in there and outside. And yeah, we often send people to jail assuming that that's going to be a detox. Lots of drugs make it into jail. So, and as with regular opioids, true chronic pain sufferers can't get fentanyl patches because we all must be drug seekers, even though it's rare for a true chronic pain sufferer to get addicted to pain meds if they're dosed properly. And I heard of one person who their pharmacy actually made them bring back their used fentanyl patches. They wouldn't give them another one until they'd brought back the previous, unless they were bringing back the used ones. Oh. And can you imagine how humiliating that would be?
Yeah.
It's just
dehumanizing.
Yeah, and if you take one of these things off and you're just not thinking and you throw it in the trash, suddenly you've got this pharmacist who's deciding that you are a drug dealer or a user or whatever else, and they're I guess that's. Do you see sort of a certain amount? I've seen sort of people mentioning it in chat, but like these petty tyrants of pharmacists who suddenly decide that they're going to be an agent in the war on drugs here.
Yeah, that definitely happens. And I think, that's a big problem for pain prescribing, but has also become a big problem for kind of the medicines we try to use to treat addiction as well. And so people will try to restrict them. The same kind of stigma happens where, insurers, employers, everyone has their own kind of negative perceptions. And at the end of the day, it just ends up hurting more and more people.
And I see this is a good point. Not every pharmacist. Yes, there's absolutely good pharmacists. I'm calling out some of the bad ones and they're they're the minority of things, but they're sort of driven by the panic, right?
Mm-hmm.
And I see somebody saying snacks for Dismas. That's a reference to the D&D game I play in. So I see in Massachusetts, they have a involuntary commitment for treatment. That's heavy. And I've heard of this too, with pharmacists refusing to fill a script. And perhaps you could tell us, what's your experience when a pharmacist, if somebody's unable to fill their prescription for validly prescribed pain medication?
Unfortunately, there's not a lot that even I can do as the prescriber. I can talk to the pharmacist, and many times, and this isn't just like a pharmacy issue. This happens with other doctors. This happens with nurses. This happens, in every profession. There's always someone who is not kind of doing the right thing. But we don't have a lot of good kind of options for when that happens, because if it is like a private business, they can refuse to fill a prescription just the same way that an insurer can cut someone off or an employer can terminate them.
And you mentioned employers. That's actually something I've seen as well with people with prescriptions. If you have to go get a urine test, guess what your employer now knows? That you have chronic pain. And so it sounds like you've seen that as well with employers firing people for prescriptions.
Mm-hmm. Yeah.
I mean, how does that help anybody?
It doesn't. And most of the time when I see it, which again is my kind of viewpoint is biased because I do a lot of the addiction work, but it'll be for kind of addiction and people, I mean, trying to kind of get out of their addiction, get into treatment, will then be hurt for trying to do anything about it when they could have just kind of continued to try to hide everything. And when we push people to do that, that's when they're going to overdose, they're going to be alone, and no one's going to be able to revive them. And that's how you end up with hundreds of thousands of deaths a year.
And I saw somebody in the chat talking about getting sued for using naloxone or Narcan. I'd encourage people to check whatever their local laws are, because where I am here in Alberta, we've got fairly robust Good Samaritan laws. So if I, as a random member of the public, am doing something reasonably to try to save people, I'm fairly protected, so long as I'm not doing something that is like wildly dumb. You know, if it's, hey, this person isn't breathing, I'm going to kick their head repeatedly, I might still be liable for that. But if it's, I thought they were having an overdose and I gave them naloxone, they probably can't sue for that. So check your laws because they vary, but a lot of places do have that kind of protection. And in some areas, they're also implementing laws that, for instance, prevent prosecution of somebody who reports an overdose, even if they are in possession of drugs. Because this is another reason why sometimes people die, is that, you know, two people are there getting high, one person overdoses, and the other one doesn't want to go to jail. And, you know, that's not a great situation there. So, and I see somebody who's asking, can you ask him about the stigma of opioids, that when friends I know who are overdosed, they've connected fentanyl to cocaine, yet we know they were taking fake OxyContin. So
yeah, I mean, I think this kind of goes back to what we were saying earlier, even about like in the fentanyl like contact or exposure stories too. The concern that people just don't want to admit that they were using drugs on the street, or taking something like that, because it is so stigmatized, because then they're at risk for losing their job, losing friends, family, all of that other stuff, even if it's going to prevent them from getting the help they need, from getting the resources that they need by not being honest about it. That is a really big problem. And I mean, one example of this that's kind of becoming more and more pervasive is these reports of fentanyl in cannabis. And so people who smoke like the flower, the plant, the temperatures destroy any fentanyl. It breaks down at very low temperatures. And so no one is having fentanyl overdoses from smoking marijuana. But people will say this if they have an overdose, oh, I was just using marijuana, because as a society, we've decided to make that an acceptable drug, just the same way as caffeine and alcohol. And using opioids is so demonized. As I mean, anyone who has been on opioids or needed opioids for pain has probably experienced.
yeah, and was one of the big drivers of reefer madness as well, was the one of their expert witnesses who helped them ban it was going around doing court cases where he would say, oh, this person was on marijuana, so they can't be responsible for murdering their girlfriend. So sure enough, everybody started, blaming marijuana for things. And so I suspect that there's going to be a lot of, we already see it with, I was exposed by contact. It's like, were you though, or were you just using the drug, right? And I see somebody's asking, what is your thought on the use of ketamine in clinics with a team of providers in the treatment of opioid addiction?
Well, so this is going to be a promising area, and not just ketamine. I think someone had mentioned in the chat earlier too about psychedelics, and there's plenty of other kind of treatment options that are being studied. And so there's not good evidence that ketamine will treat opioid addiction, but we do know that it's good for pain. It's good for things like depression, and certainly things that are definitely associated to kind of like opioid addiction and related issues. And so that's something that deserves to be studied, and I think is another really good option that we want more options available rather than trying to limit things.
I think that's actually one of the tragedies, is just how much the war on drugs has limited studying a lot of this stuff. Like if a doctor wants to do a study and say, hey, do psychedelics have a useful thing, it's really hard to actually do that study. So I think we've ended up being way behind on a lot of this stuff just because we can't research it. And I guess this is also a good sort of segue into, obviously we'd probably sort of prefer that nobody is, sort of abusing or addicted to drugs. What's the sort of best treatment options? How do we deal with reduction and treatment?
Well, so that's a good question, and I mean, just like pain, it is really different for everyone and every situation, and so it requires kind of a lot of like nuance and not trying to broadly give a one size fits all approach. But for like opioids, we have really good medicines that people can take, and just the medicines alone, not everyone needs or wants like counseling, therapy, all of that stuff. These are very effective. For other forms of like substance use and addiction, we don't have as great of options. And so, I mean, things like therapy, counseling, but then also the other issues like housing, trying to prevent the traumas and other issues that lead people to self-medicate and to turn to drugs, are definitely helpful as well. Kind of got off topic there.
Oh, I don't know that it's off topic so much as just happier people are less likely to become addicts, in my experience at least. And a lot of addiction is people trying to cope with other stuff. A big one I see is meth use and among the homeless. And for people who haven't really thought about what's involved with being homeless is dangerous. When you're on the streets, people will potentially rob you. They'll potentially just like homeless people get beat up by just people who are messed up just because they're there. And often these are people who you wouldn't really expect to be this kind of messed up. But so, well, one thing you can do is if you can stay awake for lengthy periods because you're on meth, well, then you're not helpless on the street sleeping. So that's sort of seeing people using meth just for its instrumental effect of keeping them awake. But, it's the way to stop that is housing. If somebody's got a safe place to sleep.
And I think we had talked about like ADHD earlier. A huge percentage of people who use amphetamines like meth are self-treating for untreated ADHD and these other conditions that still remain very untreated, or undertreated, even though we know they exist and we know that like Adderall, or these other stimulant drugs are incredibly effective. I mean, ADHD is one of the best studied like medical conditions that we have a very effective treatment for. There's very few things that we have something so effective, and for whatever reason, it's still something to this day that, I mean, prescribers, pharmacists, employers, everyone kind of poo-poos.
Yeah, it's stunning on that. And I see somebody noting that their pharmacy would only fill 1 week prescription at a time, even though they had a 30-day script. So they had to eat a copay every week instead of once a month. Yeah, that's sort of a different sort of consequence there. And there was a question here about noting that there's a huge problem with in the veteran community with chronic pain and psychological trauma, and so you get overuse and addiction. So do you have any experience with helping vets with that?
So not a ton. I've previously worked for the Veterans Administration, and they actually have a pretty strong, what's the word? Strong like foundation for anyone who's struggling with substance use issues, and I mean even things like homelessness, who can kind of check themselves in. But again, you have to be able to access this. You have to seek it out. It's not always available. Not every facility has the same, and there's still a long way to go. But I think in terms of kind of areas in the healthcare system that are doing a pretty good job at this, at least like Veterans Health has taken this on, because it is a big issue in veterans.
Yeah, I see that as well, where you've got people with PTSD or in some cases like an injury, and it can be very difficult, especially if they're not being properly treated. And when you talk about the ADHD, I mean, I've got my my prescription there, but it is, I've been moved off medications because they just didn't want, and I was just told, like, listen, this medication gets too much attention from the government, so we want to move you to a different one because I'll have to do too much paperwork if you're and you're going, but that one worked better. So it's, but, and for the people in the chat, I mean, Ritalin is, from what I understand, very similar in terms of how it functions to cocaine and similar things. We also Disoxin is a known, like, accepted treatment for ADHD, and Disoxin is meth, just meth. So it's weird how the same substance can be a registered treatment versus my client is in custody over it.
Yeah, it feels very arbitrary, and I think that's because it all is very arbitrary.
I see this shame and stigma around ADHD, and Adderall has pushed me into depression and self-shame more than it's helped. I don't understand why it continues. Yeah, and I mean, I've heard of people getting fired for being found with their attention deficit medication at work, and like that's crazy. And if you work at somewhere where you have to take a urine test, a lot of these tests don't necessarily distinguish between the legal version and the illegal version, because they might be the same thing.
Yeah.
So, I mean, I wish I could say I had lots of answers here, but I can't say that I do necessarily, other than I think that a lot of what we're doing here is, as a society, is counterproductive. And
I think the more we can have these conversations about drugs and the things that lead people to use drugs, the way people are treated, and kind of try to break down the stigma, it does make a really big difference. I mean, these are conversations I try to have with everyone I know all the time. I mean, the Narcan Naloxone is a great example. Just how many people believe that you shouldn't have that around, and if everyone just had it on them, no one else would be saying that.
And I see somebody who's asking for opinions on safe drug use sites.
Well, so whatever you want to call them, the supervised consumption site, safe use site, or overdose prevention center, these have a lot of great evidence behind them. They have more history in Canada, but some recently opened in the United States. And basically, I mean, people, instead of having to use their drugs alone in their basement or behind a building or something like that, they can go in a setting where someone can monitor them, so that if they were to have an overdose, they could be revived and treated. They also usually will have access to things like social workers, to kind of resources for housing, for employment, for programs to get into treatment if people want to stop using drugs. And so the interesting thing about these is that people worry that if you make it accessible to use drugs or give people this public option, it seems like you're encouraging drug use, but the data says that this actually reduces rates of drug use and gets more people kind of into long-term recovery who have problems.
I think the one thing that they run into is that they typically open these up as like a single pilot site, and then of course what you get is people congregate around the area, and then that makes the neighbors very unhappy because uh, because of they just go, oh, there's all of these people in this one spot. Because and what you do see is, I've seen people who've gone to these sites and have been put in connection with, like, okay, let's get you into treatment. But you don't see that if you're the neighbor, and you just see people sort of lined up outside this site waiting to go in. It seems to me that they would do better if they actually, said, hey, we're going to do a pilot project and we're going to open up 10 of these rather than one. But
yeah, and I mean, everyone for the most part has a supervised use site in their local region, because bars and anywhere that sells alcohol is a safe use site. I mean, for all intents and purposes, that doesn't always pan out. But the goal is that people are kind of using publicly if they're drinking too much or doing things that are unsafe, that they can then be cut off or dealt with. And really, the alternative to kind of safe use sites for drugs like fentanyl is just unsafe use sites, because that's where people are using them. If they're not using in a place where they can be revived, or get help that they need, then it's unsafe use.
And the flip side of that as well is also things like I grew up in Vancouver, and there's some parks you can't walk through because there's too many syringes, or at least there were when I was there. So I was just thinking, wouldn't you rather have all of that being done in a place where, they're not, you're not having that kind of impact on the community? It's tough, but the point about bars being a supervised consumption site is exactly it. You've got people there whose job it is to say, you've had enough, right? And we don't seem to mind so much that we have bars there. And I say that I see that East Hastings is better now. For a while, East Hastings was pretty bad. Somebody noting I had amphetamine come up on a patient's talk screen. The nurse who gave me a report made a big deal of it, pointed out the ADHD in the medical history, and said, move on. Yeah. And the number of people in the criminal justice system who are dealing with attention deficit issues is huge. I've seen estimates saying like 60 to 80% of people who are in the criminal justice system are potentially, and when you think about it, sending somebody to jail if you have attention deficit is so much worse punishment than you might otherwise think, because being locked in a room with nothing to do when you have attention deficit is basically hell. So, I see a question here. Have you noticed a reduced addiction potential with the time-release medications over the regular medications?
So it all depends. Not necessarily. I mean, I think for things like ADHD, for those stimulant medications, that kind of helps give people more coverage and smoother control. For things like opioids and pain medicines, you get the same benefit from something like a fentanyl patch, which doesn't necessarily have much addictive potential. And the immediate release things, I mean, like an oxycodone, can sometimes have more increased addiction potential. But we also saw back when, like, the Purdue Pharma or the Sackler family was pushing for the extended release medicines on everybody, that also had increased problems as well. So it's kind of, once again, I mean, this isn't a great answer that I keep saying, but it's a fine line, a lot of nuance, There's no real one size fits all.
Yeah, and I mean, from my sort of experience with attention deficit medication, there's benefits to both, right? Something that is quick release works now, but sometimes you want to just, an even effect. It just seems that it's more just, I think, different therapeutic profiles. So, and when I burn the heck out of my hand, it. I was given like Tylenol threes. It would have been nicer not to wake up in the middle of the night to have to take another one. Because if they last, 4 hours, then you wake up and you're like, well, I'm still, still in a lot of pain there. So, yeah, I don't know. And I see people asking about, are you familiar with Ehlers-Danlos syndromes? Who my understanding is that they do have a higher need for sort of pain management because of that. But
yeah, those people experience a lot more chronic pain. I, again, am not a pain expert, but I'm familiar with that.
All right. Well, I think we sort of covered a whole bunch of things. If there's sort of a sort of sum up message here for people that you'd like to give, do you have sort of final thoughts here?
So I think at the end of the day, I mean, drugs are ubiquitous in human civilization. Everyone in your life is using some sort of drugs. We have kind of arbitrarily made some of them be good and bad, legal, illegal. And the more we kind of push people away and other them, we're pushing people into dangerous territory like we see with fentanyl. But the message I would say is not to kind of believe everything at face value, even if it comes from the media, from the government. There is a lot of nuance here. Fentanyl is a great example of kind of the misinformation and confusion, frankly, oftentimes more so than misinformation, just confusion and lack of good information that comes out around drugs. But so keep having these conversations, ask questions. There's a lot to learn for everybody.
Well, I really want to say thank you for coming on and talking about all of this, because I think it's a really important conversation that people have, and especially talking a little bit about some of the myths and dangers, because that is genuinely hurting people. And so I'd like to be part of the conversation in terms of breaking up some of those myths if I can. I see we got a last question here about, do you have thoughts about tianeptine? I'm not sure if I'm pronouncing that right.
So tianeptine is one of those, I'm assuming this is what the context is. It's one of those other substances that's kind of showing up in street drugs and is making things more difficult to treat and less predictable than they were before. So, I mean, if people had access to kind of, in other countries, they'll have access to prescribed heroin that you go get from a pharmacy and you use in front of them. I mean, that takes a lot of the risk, takes a lot of the dangers out of this. We do have other options. I mean, I'm not saying that that's the only thing, but when we keep making street drugs more and more weird, they get more and more unsafe too.
Yeah, and that to me seems like a great, a great option of, okay, we recognize that you're an addict. Maybe we can give you safe drugs and help you with resources to get off them. But this whole thing of, expecting people to just kind of survive this gauntlet of I don't want to say poison. It's the word that comes to mind, because everything is in doses, right? I did some volunteering on a mental health ward, and people managed to poison themselves with water. But it's this whole thing where we just kind of accept these, like this 100,000 deaths. It's madness to me. So, and I know people can follow you on Twitter, Ryan Marino. Is there any other sort of social platforms you're on?
That's the main one.
So check him out. There's a lot of good stuff there. Occasionally, he'll do something along the lines of, "Hey, if you find this, product, should you consume it?" So there's a lot of good commentary, a lot of both uh, useful useful information on drugs, and also a lot of sort of fun commentary there as well. So check that out, and thank you everyone for joining us, and we'll see you next time.
Thank you.